Today on this episode of the Brain Surgeon's Take, we will be discussing the next pandemic, not if, but when, with President of PHC Global and former Chief Staff Counsel for President Obama, Kendall Burman. Learn why COVID was just the beginning and how the next world-changing infectious disease may be just around the corner. What can we do as a community, country, and civilization to appropriately prepare? Much more on this podcast episode. Welcome back, everyone. Here's my take on Kendall Burman. She is a nationally recognized public health expert who understands how devastating a pandemic can be to our society, especially without preparation. As former Chief Staff Counsel for President Obama and current president of PHC Global, she clearly has experience with the proper measures that need to be taken before, during, and after a pandemic. This interview sparked flashbacks for me, as the COVID pandemic clearly negatively impacted all of us. Unfortunately, humans tend to have a short memory, allowing bad events in history to repeat themselves over and over again. Our experience with COVID has been no different. Now that it's over, everyone wants to forget that it actually happened, and instead of learning from the experience and preparing for the inevitable next pandemic, everyone has moved on with their lives. Many experts believe that the end of human civilization will come at the hands of an infectious disease. It's very possible considering how vulnerable we are as a species. Listening to Kendall Burman, it is clear that we can protect ourselves, though, through education and preparation. Question is, will it be enough? Listen up as we discuss the next pandemic, not if, but when. Check it out. Hey, Kendall, how are you?
Hi, Rick. Thanks for having me. I'm doing great. How are you?
Good. Very excited to have you on the podcast today to talk about the next pandemic, not if, but when, and your amazing company, PHC Global. So very excited to highlight that.
Thanks. I'm very excited to be in this conversation, and I love talking about PHC. So terrific.
Well, perfect. Let's give our listeners a little background. Obviously, everyone knows about COVID, which started in 2020 and went on for about 2 years. How ill prepared were we as a country for COVID?
Yeah, so let me start about kind of why the company was founded, right? So PHC is a biosecurity intelligence company, and we provide early warning capabilities for enterprises to protect humankind and capital. And it was a company that was founded in 2020. So, obviously at the height of COVID in a lot of ways by Dr. Charity Dean. And it was, really based on two foundational ideas. And one of them was obviously that the experience that we just were living through at the time with COVID was, in some ways just a preview of the biological threats to come. And that these threats are dynamic and increasingly complex, and that they impact not just our global health, but our economic stability. And they're, hopefully the experience of COVID was a demonstration and a warning of that. But the second foundational principle, I think, is for the company was really that early detection and proactive management of these biological threats, it's not only possible, but it's critical. And we can be in a much stronger position, far better than, we were with COVID if we, take this seriously and we're invested in the right ways. And so, PHC was born, sort of out of that impetus. And, the focus that we have, obviously this is a complex and a massive problem that touches many areas of not just government, but also how corporations respond to threats and individual behavior and all of that. But just for what the company is focused on, we developed software that provides this early warning capability. We sell primarily to chief security officers of commercial companies. And these are the people who have been on the front lines in responding to COVID and understanding the threat that we've been facing and that we'll continue to face on the biological, not just the biological side, obviously, but chief security officers are keenly aware of threats of all stripes. But that's where we're positioned, is on the software side.
Now tell us a little bit, right? Because if someone like myself who's not in the field hears about a company that can predict bio threats, it seems like science fiction, right? So tell us how your company, PHC Global, functions. How do you predict threats? How accurate is it?
Yeah. So the thing I obsessively, sort of think about from my standpoint at the company is, how are we in a position to take full advantage of all of the innovative technologies and leading edge AI and machine learning tools to empower both government and commercial decision makers to have the kind of intelligence that we need to facilitate, decision making that is both swift and scalable. And there's a lot of aspects that go into that, but just kind of one example of this is, in order to understand what an emerging threat is, you need to have a pretty sophisticated and rapidly developing sense of what your baseline is. And so what we have at PHC is just one aspect of this, is what we call an endemic intelligence layer that will tell you whether something is anomalous or not, or to be expected. If you see a case of dengue fever, for example, if you want to know whether that's a real problem or something to be expected, you need to have a real complete picture of what the baseline should be in that area, in that season, at that a specific time, given the vaccine rates, given the infrastructure, and we do this kind of across different threats. And so we've developed that capability, so then we can understand what is anomalous and what isn't. And so that's I think nothing like this exists out of PHC, and it certainly wasn't around during COVID. But what we need to have is a picture of intelligence that enables decision making, and that isn't precisely correct from an academic perspective, right? But if you're waiting around for an academic paper to be published, you're not in a position to make the right decision at the most relevant time for the types of customers that we're serving, which is people that need to make decisions about their supply chain, who need to make business decisions about where to invest, in different areas, about the safety of their employees and travel decisions. And so all of that is, much more complicated in a world where these threats are compounding and developing in a way that, it necessarily requires a software tool to keep track of.
Now, your company name is very accurate, right? PHC Global. We learned during COVID that these pandemics can come from anywhere on the globe. Discuss the scale of your company. I mean, you guys are monitoring the entire world, because these epidemics, pandemics can come from anywhere.
Yeah, that's absolutely right. And, one of the challenges that I think, really came out during COVID was that the data available, even at the height of COVID, when we were in this really data rich environment, right? When the New York Times had the tracker on its website for, hospitalizations and infection rates, even under those circumstances, which was like the best case scenario from a data perspective, what you have is a situation where there's a ton of variability in terms of, not just whether that data is available, right? Like PHC isn't built on, necessarily just, we're built on proxy data, right? So we're not waiting for the hospitalization data to come in or the infection rate to be reported from a public health officer. We're looking, earlier signals through different types of data and correlating that. So the data picture is incredibly complex, and it varies depending on what is available, what is the best available data for that place in the world. What the data that was coming out of Florida, for example, was much different from the data coming out of California, which is much different from the data that's coming out of China. Just as COVID as an illustration of this. And of course, when you're trying to get at early warning and early detection, that gets even more complicated. But the good news is that decision making can be informed by a whole wide range of data sources. And software can be architected in a way to take advantage of that, to be flexible, to be adaptable, to be threat agnostic. But it needs to have at its core and its root real public health and infectious disease expertise. And so at PHC, that is tantamount to what we deliver and what we build. Our public health experts are in the cockpit every day. There's nothing that's delivered to our customers that doesn't have a human expert who's reviewed it and understands it. Our goal is to, deliver that epidemiological expert brain and software, but that has to be led by expertise. And by the way, that is not my background. And so, this is an area that I've been learning as well. My background is on the data and technology side. But I, experienced COVID just like most of us did, which is as a regular person and trying to run a business and run a family. So I'm, learning this through this job, and empowering our experts and learning from them every day.
Let's go back to COVID, and clearly we were very ill prepared, not only as a country but as a civilization.
Mm-hmm.
If we could do it all over again, let's say PHC Global instead started in 2015, what would have been different?
Yeah. I mean, it's a massively complicated problem, and there's so many different aspects to it. It's whole of society, it's whole of government. It drew on sort of all of us at the time, as it should. And my hope would be, to the extent that there's a next time, which I believe there unfortunately likely will, that we're all in a better, stronger position to do that. I still think personally that there needs to be a deep and thorough kind of after action review. In some ways, it's regrettable the way I feel like some folks have kind of put blinders on to that. It's in the recent past, but I still think it deserves attention. My perspective, being steeped in the data and technology side is one kind of basic thing that gets overlooked, is that we would all have been better served if we had a common operating picture in order to make better decisions. And, instead it was very fragmented, and not just in terms of the data inputs that were coming in, as I mentioned, the different, sort of regional data that was available. And, you have a decision maker in one area that, obviously it flows down and impacts others in that kind of quickly evolving space. But I think in a very simple way, you need a common operating picture for the outputs of that intelligence, right? Like, you want decision makers to have information available to them in the right way that's convenient for them, and that is done simultaneously. And we didn't have that, and it's such a basic thing in so many ways. You go in other aspects of our lives, this is accomplished through data and technology, and we don't even think of it. You have your airline app on your phone, and it updates with that it's been delayed, or that your seat changes. You have that experience, and it's seamless. There needs to be that kind of approach across public health and public policy needs as well.
Now, how do we keep politics out of public health, right? It seems like those two should not go together. And you just said it's about having a streamlined data group where the data, it's factual, it's
Yeah.
science, it's information. How does your company, PHC Global, or how will it potentially keep politics out of public health?
Yeah, I don't, that's I don't know that politics will ever be out of public health. I think the reality is that it does impact it, and it probably always has. Maybe not to the degree we think now, but I don't know. I worry about the degree to which it interferes with good decision making, right? So, not that you can ever remove politics out of it, but how can you mitigate the way it might impact, the best decision making, and I look at, how do we root ourselves in expertise and science, and do it in a way that's relevant to decision making and in a way that is trustworthy to those who are impacted by those decisions. Um, I certainly don't have all the answers, but one way we're approaching it, at the company, is, and I think we can be particularly helpful at the commercial level. So, if you think of the kind of aftermath of COVID and returning to work policies, or travel requirements, or the decisions corporate leaders were faced around how to bring their employees back to work safely, if that was the path for them, and how to do that in a way that would build trust in workplaces that obviously all of us had gone through so much at that time. And one of the ways that we do that at the company is we want to empower those decision makers to be able to provide, to their employees, if they want to, the source of the information used to make those decisions, as well as an understanding of the process or basis for making that decision. And so, the alerts and guidance that we serve through our software, are really designed to support that transparency and trust. And we standardize the process so that decision makers, have it all at their fingertips. And they can easily share, the not just, that they're obviously getting the intelligence from PHC, but how PHC's process works. And we do that without, making the decision maker do that work on themselves, which obviously, there's so much on their plate. And we want to do it in a way where if they choose to, they can also share that information out with employees themselves. And so they have a understanding of how that decision was made. And I think that if you deliver facts, and the right level of transparency, that trust, that's where the trust can come from. And I think that was such a hard thing to navigate for a lot of us during COVID.
Yeah, I think you really hit a hot topic. I think one of the biggest issues with COVID, something that really prevented us from responding the right way, was the misinformation, all the distrust, all these conspiracy theories that ran wild, that the
Mm-hmm.
vaccine and all these crazy ideas that were coming out of all the different social media channels. Will your company,
Yeah.
PHC Global, do you think for the next pandemic, whenever that does happen, would it curtail those confounding variables by providing solid, reliable, data-driven science information?
I hope that we would help, it as a basic answer. The misinformation piece in particular, is something I worry a lot about. And I don't think you can do the work that we do using AI and technology in this space without, taking that really seriously. Um, One of the examples of how we wrestle with this, for example, is we have, a specific section, of our product that is dedicated to critical threats. So right now that catalogs alerts and analysis around H5N1, around Mpox, and around measles. In all of these cases, the risks and severity or mutations or transmission risk here is high enough that we want to get information to people, and raise the right, sort of level of attention. Um, but I'm also sensitive to the fact that, like, what is a critical threat to, one customer may not be understood to be a critical threat to another customer. If you're in agriculture, you'd probably be, pretty much tracking H5N1 right now. I'm not sure that that's, applicable to every industry, obviously. So you want to make people aware of what's relevant to their decision making without ringing alarm bells unnecessarily. And sometimes that means saying something like, you probably heard a lot about X in the media. Here's why you don't have to worry, because we need to be responsive to not just the, biological threats on the ground, but what people are experiencing in the media as well. And one way we've kind of done this as a company, and is to make sure that our experts are evaluating and grading every data source and forecast that we make. And so we provide a confidence level for our predictions and analysis. And we do this in a very data science informed way. We actually use numerical values, and we attach it to the credibility of a source. So whether it's a traditional source, or whether we think its source could be true, but is possibly, there may be reasons to doubt some of its credibility. We look at the suitability of a data source, so kind of how accurate or credible the signal is from that source. And we also look at how representative of that source is for a given location. And the picture that we're trying to achieve is that we know that in some cases, the most valuable piece of information we can give is a warning of a threat that is so serious, but that we still have a low credibility of how likely it will be. And you think of that in the context of COVID, how might that have shifted the way we look at the world, in April of 2020, for example, in terms of, or earlier, excuse me, where you to get a signal that something was so dire, but that we were still wrestling with how real that threat was, and just kind of changing your framework for how you understand threats in that way is really powerful. And we want to give that information, to put that information in people's hands, so that we don't need to be certain, but we're going to give you an indication that something is serious and might be coming. And you can make the decision based on that information as it becomes available, and that will shift, obviously, with time.
Now, people use the term biosecurity, and you just used it earlier in the talk. Number one, what is biosecurity, and how is it similar or different to cybersecurity?
Yeah, I love that question, because my early part of my career and the middle part of my career has really been focused on cybersecurity policy, and I think about it a lot in this space. Biological security and biosecurity, as we use it, are threats in the physical space that have at their core a biological risk attached to them. And so we're primarily focused on infectious disease, but when you think about climate change, when you think about geopolitical risks, all of these are compounding the picture in a lot of important ways in terms of the risk picture on the biological side. And I think there is a lot to learn, and a lot to sort of understand in terms of cybersecurity on the bio, which I think is more a little bit more advanced in terms of our public and private responses in some ways than biosecurity. So if you just think of it from a threat perspective, on the one hand, a zero-day exploit in cybersecurity terms is very much like an unknown pathogen in biosecurity. These are things that you want to know about immediately, that can start very small, that you want the right players to be motivated to take action right away, and because they can cause a huge amount of damage as they grow and develop, and it's becomes very difficult to take measures after they get out of hand. And I think some ways the kind of frameworks we've adapted both on the government side and certainly on the private sector side for how to mitigate and address cyber threats and improve our practices around cybersecurity can be really informative, and good models for biosecurity as well. And ultimately, this is a tragedy of the commons issue in some ways, and you want to have improvements in terms of responsiveness and understanding of the threat picture in order to have good public outcomes here.
Now, talk about AI, because you mentioned that also earlier in our discussion. Obviously, your company must use the most advanced AI to predict these threats, just go into a little bit of detail about the AI that your company utilizes.
Yeah, AI and ML are huge for us, and they're that's part, that was a foundational principle again for why we founded the company, because there's so much improvements that can be achieved by utilizing AI and ML in this space. And it's not just because the data picture here is so complex, and efficiencies and better analysis can be done through the correlation of that complicated data to get a better picture. But it is also when you root expertise at the core of its development, you can put us in a much better position than we've ever been. And one example of this is we have a tool now that allows us to predict absenteeism from infectious disease like influenza, um, up to 5 weeks in advance of what you could use just looking back at historical models. And that's a huge improvement about where things are. So companies can actually make plans much earlier than they would be reacting to the develop flu cases in the winter and so on, in terms of how to prepare. And that's not possible without kind of the AI and ML tools that we're able to avail ourselves of. I think it's it's interesting to me just in terms of a policy, from a policy perspective on the AI side. I think it is really significantly important that people are focused on the safety and the actual, kind of physical harm that can come from AI decision making that doesn't have protections in place. And it's always been our ethos at the company that we put humans in the loop every single time. There's no, as I said before, there's never a situation where a human isn't involved in this, but the efficiencies that can be achieved and the insights that can be achieved, just wouldn't be possible without those tools.
What is the number one biosecurity threat that your company is tracking right now?
I am not in the business of the ranking, but I would say that I think MPOX folks should pay attention to MPOX. And I think the other, aspect of this, you're always the number one, suggests the thing that is, at least in timeline, is the most serious. But, I personally am really motivated by the work that we're thinking about in terms of what climate change will mean, in terms of how that's going to impact infectious diseases. In the future, you see this with the mosquito-borne illnesses that a lot of us are paying attention to, and so I think both of those are MPOX, and what we're seeing with mosquito-borne diseases is really important.
So give us your kind of crystal ball view, looking at the next 10 to 20 years in this field. What are the most important developments that you see happening in terms of data and technology?
Yeah, I think, look, like on the good side of that question, we're in such a stronger place, and there's I think even during my time at the company and the developments around generative AI, for example, we are at the forefront of being able to see what we're capable of in terms of anticipating and preparing for biological threats. And I think that's just remarkable, and all efforts should be taken to take advantage of that. On the not so positive side, if you just look historically as the teacher, whether that's the bubonic plague or the Spanish flu, COVID was not an outlier. And I think you have to think seriously about whether that was the last pandemic of our lifetimes or a preview of what's to come. And I think at least in my education of being with this company now, and the spooky, scary stuff of the unknown novel pathogens, I think investment in biosecurity is just incredibly important, and needs a whole of society response. So I think the reality is that things are going to get more complex. They're going to move faster, and they're going to be compounding in ways that we need to really wrestle with. And I feel fortunate that we're at a time where at the forefront of the kind of the bleeding edge of this technology that we can capitalize on.
Kendall, what a terrific interview. I think that, as we discussed prior to the podcast, that the next pandemic is not really if, it's when, and more likely it's sooner rather than later, just given the population and the travel and all the opportunities to have these pandemics are just simply increasing. And I think kudos to you and your company for being on the forefront, PHC Global, to hopefully help us have a unbiased, scientific, data-driven source of information such that not only as a country, but as a civilization, we can prepare for the next pandemic, because it's definitely coming. People who think that COVID was the last, obviously that's not correct. And most likely the next pandemic will only be worse. So again, thank you for helping us all with your company and hopefully helping us protect us from the next pandemic.
Well, thank you for the conversation and for your attention on this issue. It's been a delight, and I really appreciate it.
Well, you have a wonderful weekend. Talk to you
Thanks.
soon.
Okay, take care. Bye-bye.